Thank you, Minister. So today's numbers and geographic spread show why we need to continue to slow this virus down until as many Victorians are vaccinated as possible, as quickly as possible. And the outbreak of this Delta variant of COVID-19 continues to be focused in younger people. So only 12% of the cases reported today were aged under 50 years. And when we look through all of the 1,029 active cases currently living with COVID-19 in Victoria, looking at that age breakdown, for those aged between 0 and 9 years, there's 192 active cases. Between the ages of 10 and 19, there are 157 cases. 20 to 29 years, 243 cases. And 30 to 39 years, 183 active cases in Victoria. So that means that 3/4 of our active cases are aged under 40 years. And there's a few reasons for that, but one of them clearly is the higher levels of vaccination in older age groups. And it really emphasises the urgent need to get vaccination to every eligible Victorian we possibly can as soon as doses become available. So there's not one corner of metropolitan Melbourne that's not touched by this virus. We have been seeing and continue to see high case numbers in the suburbs to the north and the west of Melbourne. And we're still really concerned by the number of cases and the trends we're seeing in the suburbs of Altona, Broadmeadows and Truganina. But then, as the Minister was just highlighting, today we've seen a significant increase in suburbs throughout the south and east of Melbourne as well. And the only way to keep applying downward pressure on these numbers is for us all to do this together, regardless of where we live. So if someone that any of us knows, anybody in the community, says it's okay to visit friends and extended family because it's just for a short period of time, we have to remind them that this virus is here right now and it's spreading fast. And the increasing case numbers are a herald of what our health system is going to be faced with in the coming weeks and months. Also, some people think that because you're young, if you're young and you're fit, then COVID-19 won't be a problem for you. Young and fit people do catch COVID, and some of them get really sick, and tragically, some of them lose their lives. I myself have looked after people in their 20s and 30s in hospital with COVID-19 through the course of the last year. But even if these people are lucky enough not to get really ill from COVID, every likelihood is that they will be passing it on to their family. In a number of households we've seen in recent weeks, when we test the household of the index, the first case in that household, every single member of that household is infected with COVID when we do the testing. So household transmission is far greater with the Delta variant than even it was with the original COVID-19 strain we encountered last year. And so when these people then go to extended family groups and to other households, they take the COVID with them, and so on and so forth. So thankfully, we're not seeing an ongoing high rate of community transmission in regional Victoria, which is an incredible achievement. There's been no identified onward transmission that we're aware of from the exposures in Echuca and Traralgon. The 13 cases in Greater Shepparton that the Minister highlighted previously are the results of day 13 testing. And again, my thanks and of the whole public health team to those who are doing their isolation, doing their day 13 testing and protecting the community by doing so. So the Shepparton community do continue to do the hard yards of isolating, and the arrival of day 13 testing is great news for many of them. Thousands of tests will be conducted in the coming days, and additional resources have been brought in from the Metro Rapid Response and the Bendigo Rapid Response to support this really huge undertaking. The local public health unit has been in touch with local school communities to plan testing times and to try and spread the testing load throughout the course of the day. So there are thousands of tests to be done. And if someone doesn't get their day 13 test done on day 13, it can be done on day 14. It doesn't trigger an extension to the isolation period or the quarantine period. If it's done on day 14 and it's negative, then that clearance will occur in a timely fashion. So we will be in touch with everybody involved and help them through that process. Can I also thank the over 33,000 Victorians who had a dose of vaccine in Victoria yesterday, in our state system alone. 70% of eligible Victorians vaccinated with their first dose. It gets us to where we want to be. Protecting against the virus, easing some restrictions, and critically, protecting the lives of Victorians and protecting our health system. We know that Victorians of all ages do want to get vaccinated, and Victoria has opened up eligibility to anyone aged from 16 years and over last week. And within 48 hours, hundreds of thousands of appointments were filled by those newly eligible Victorians. So our vaccination hubs are busy and the new drive-through sites are really popular. If you're booked in for an appointment at the Royal Exhibition Building, it's an important point, from next Monday through till the end of September, you'll be notified of a change of venue to the neighbouring Melbourne Museum. The temporary museum site will have the same vaccination capacity, around 2,000 people per day, and will operate for the same hours, 8 a.m. till 4 p.m. And these bookings will be updated automatically in the system. People who have bookings will receive a text message that will provide information on the new location details. And you'll still be vaccinated by the fantastic staff at St Vincent's Hospital who run those sites. This is a temporary relocation to allow for essential heritage work to be undertaken at the Royal Exhibition Building site, and vaccinations will resume there after that work is completed. We may be limited in terms of the Pfizer appointments available in the system at the moment, but it's important to note that there are still over 52,000 available AstraZeneca appointments in the next 2 weeks. Today I can also announce that the dosage interval, so the spacing between the first and the second dose of AstraZeneca vaccine in Victoria, will be revised down from 12 weeks to 6 weeks in all of our state-run services. So that matches the dosage interval for the Pfizer vaccine. So it'll be 6 weeks for AstraZeneca and for Pfizer bookings going forward. And these changes will be active in the booking system from today. So this change and the additional supply of Pfizer vaccine from the Commonwealth when it arrives in Victoria will help us to reach our vaccination targets faster, but more importantly, they will really contribute to the response to community transmission, put a downward pressure on cases, and contribute to protecting our health system as we look after all Victorians. There is nothing more important as we come towards the end of the year than getting vaccinated. The current outbreak in Victoria and the ongoing situation in New South Wales is further evidence of why we need to protect as many Victorians as we can, as quickly as we can. So if you're yet to be vaccinated, please book in your appointment today, either in the state system or with your local general practice or pharmacy. And if you have any questions or concerns, as always, you can talk to your trusted local GP, pharmacist or nurse immuniser or other senior immuniser at our state-run sites also.